Hey, my name is Darius, and I'll be your nurse today. I have orders to perform a head-to-toe assessment. Is that okay with you?
Yes.
All right. And I would wash my hands, provide probably for patient. Yes, I'm going to verify your identity. Can you state your name and your date of birth for me?
Mary Smith, July the 4th, 1975.
75. All right, and can I see your armband, please? Thank you. All right. So to begin with your head-to-toe inspection, I'm going to start off with your hair, your skin, and your nails. Is that okay with you?
Yes.
All right. So if you don't mind, could I remove your cap real quick just to inspect your hair and your
Yes.
scalp? Okay. Don't know anything out of the ordinary. Let's see. All right, good. Can you hold your hands out like this? I'm gonna check your temperature with regular hands. Noticing the skin color, temperature. I'm going to check your capillary refill of your fingers while I'm here. Just get blood return. If everything goes right with the capillary refill under 3 seconds, then that's a good sign. What they did, by the way. Next, I'm gonna check your skin integrity. There's elasticity by pinching the skin under the clavicle. See how long it'll take for the skin to return. That's good. Let's see. And the risk 3 factors for skin breakdown. There's friction, there's activity or lack of activity, and it's having a good proper nutrition. And do you have a history of any like skin cancer or any spontaneous skin breakdown, eczema? All right, great. All right, I'm gonna check your head and your ears and your eyes next. Let's see. For your head, I already inspected when I was checking your hair. Your face looks symmetrical and your ears look symmetrical. Have you had any problem with your hearing recently?
No.
All right, good. Have you had any problem or any issue with spontaneous headaches or memory problems?
No.
All right, good. So I'm gonna move those. We're gonna test the light, your pupil's response to light next. So if you could you look forward and up? Well, could you remove your glasses first? And then could you look forward and up? Okay. All right, good. Those pupils seem to be around 3 millimeters. Next, I'm going to check how your pupils dilate and contract. I'm going to get you to look directly at this pen. I'm going to bring it slowly, closer and closer to your face. Okay, you ready?
Mm-hmm.
Taking your orientation, make sure both eyes follow the pen at the same time. What they do, that's good. Let's see. Have you had any? You say you had no problem with your vision outside your glasses, right?
Right.
Where's the glasses? All right. Have you had any problems with swallowing? Or?
No.
And sense of smell, that's okay too?
Yes.
Okay. Now check your nose. Symmetry on both sides. Mouth symmetry on both sides. Okay. Could you smile for me and show your teeth? I see your teeth and gums. All right, good, good. I see your tongue. And You tilt your head back a little bit so I can see the roof of your mouth. Everything checks out with that. Also, let's see. Good. All right, could you kind of lean your head backwards around 45-ish degrees? I think you can. Could you face the right? Check your thing, your neck for extension. No, everything's okay with that. No vein problems. And to explain what the Glasgow Coma scale is a scale that tests the level of alertness and mental acuity in someone who is or has been a coma patient. Have you ever had a coma, Mal? All right, great. All right. Have you had any problem with your breathing or your respiratory rate?
No.
Right. No mucus, no coughing up, no phlegm?
No.
All right, no. All right, next I'm going to test your respiratory rate, and I'm going to listen to some of your breathing sounds on your chest, your anterior chest, your back, and your side here. Is that okay?
Yes.
Wipe out my stethoscope. No, I performed this skin to skin, but for the purpose of this video, I will not. All right. When I put the I put the stethoscope on the different spots on your chest, I'm gonna ask you to breathe in and breathe out. You breathe in as deeply as you can, okay? All right. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. All right, breathe in. Breathe out. And could you lift your arm up for me so I can get it right on? All right, breathe in. Breathe out. Everything sounds good so far. All right. I'm gonna check 4 ears on your back, and next time I'm gonna get you to raise your left arm, okay? All right. Breathe in. Out. Breathe in. Breathe in. And out. Breathe in. And out. And could you raise your left arm to the side? Okay. Thank you. Breathe in. Breathe out. All right, thanks so much. You know, it's nice and clear. The respiratory rate was 16. You breathe good without extra effort. You said no sputum, no breathing problems. I'm going to educate you on the cough turn and deep breath technique, and on the use of incentive spirometry. Cough turn deep breath is a technique that helps with clearing sputum from your throat, in which you turn, take a deep breath, and you cough, hopefully coughing up whatever object you have in your throat. Incentive spirometry is a device you use. You're going to breathe in deep as you can, 10 times per hour, or during every commercial break of your favorite show. It's a device that helps the strength of your breathing, kind of like an exercise for your lungs. All right. Have you had any history of heart attacks or heart fluttering, stroke?
No.
All right. Good. I already checked your jugular vein. I'm going to identify and palpate some of your pulse spots. I have to check 2, but I have to identify 4. Your radial pulse is going to be on your wrist, or what we call wrist, the wrist area. Your posterior tibial pulse, that will be about, what's it? Right here on the patient. Your dorsalis pulse will be on the top of the foot. And I think the other one was the, let's see. Oh, that's it. Palpate two of them. I'm going to palpate your dorsalis pedis when we get to the foot area. When I get to, well, I guess I can do that now actually. Let's go ahead and do it now. It's okay if I move one of your shoes?
Yes.
Regular rhythm, say good and bound out, say maybe about a 3. Check your radial pulse if you don't mind. It's about a +2. I can feel it, it's consistent. All right. We're going to also take the different sounds of your heart, 5 different areas. Is that okay?
Yes.
Okay. And with this, you just relax. In order, that's the aortic area, the pulmonary area, the Erb's point, tricuspid, and mitral valve. And right after the mitral valve, you will get the apical pulse. Alright. Everything good on that? And now I'm going to be checking your gastrointestinal area. And for this part of the video, I will get my patients to lie down on a table or a surface, and I will inspect the skin on their stomach for scar tissue, wounds, any sort of uneven areas, skin color. But for the video, I'm just gonna say that. See. And I will auscultate the patient's bowel sounds. If I hear any, starting off at the right lower quadrant, if I hear any sort of movement, then I'm okay. If I hear hypo movement, it was very slow, then I will go to all 4 areas in a clockwise fashion, starting with the left-right quadrant. For this video, I'll do that like this. It's okay if I check your stomach sound, your abdomen sounds?
Yes.
Starting right here, I'll go here, to the right upper, to the left upper, and then to the left lower. And I'm going to ask you, also going to palpate. Palpate like this in a slow fashion. You want to put too much pressure on the person's abdomen area. I'll ask you, do you know or have you had any problems having a bowel movement or passing gas, flatulence?
No.
You remember the last time you had a bowel movement?
Yesterday.
All right, cool. Yesterday. And no. All right. And you remember the last time you passed any urine?
Yesterday.
Yesterday?
Today.
Today? Okay, good. Today. So you say the morning, it's afternoon?
Mornings and afternoon.
hold. And have you had any discoloration or strong smells in your urine? Okay, cool. Alright. Last but not least, I'm gonna test your musculoskeletal capabilities. I'm going to perform some range of motion with you on your upper and your lower body, and I'm gonna assess your walk. First off, I'm gonna test the range of motion with your, let's say, forearm area, kind of sort of your elbow. I could borrow your arm. I'm gonna perform these motions with you. We call this a flexion. Call this extension. And going back further beyond that would be hyperextension. When it comes to your fingers, having them pointing outward normally would be called extension. Pushing them back like this would be hyperextension. Bring them up to make a fist is a flexion. You would take your thumb in there too. Can I borrow your hand? All right, thank you. Spreading your fingers out is adduction. Bring your fingers back together is abduction. All right. And can I borrow one of your feet again? Thank you. In this part, I will get you to push and bring your toes inward with your foot. I will call that inversion of your ankle. Eversion is pointing your foot outward. Pushing your toes down would be plantar flexion, and bring your toes upward would be dorsiflexion. And down here. Also testing for edema, so I'm down here on the little area. Everything's good. Thank you. And with that, I believe our assessment is concluded. You have any questions or concerns?
No.
All right, great. I'll leave you with this call light. If you need anything in the meantime, you let me know, okay? Oh, one more thing. Are you in any pain?
No.
Okay, great. If you need anything, you let me know, okay?